This is our presentation on virtual reality and mental health for OT 620. This video is just a short clip on how VR can benefit patients with mental health disorders.
In a typical virtual reality exposure therapy session, clients wear a VR headset that displays a 360-degree virtual environment, often accompanied by realistic sounds and sensations, to fully immerse them in the experience. Under the guidance of the clinician, they begin to explore and engage with anxiety-provoking scenarios, confronting their fears step by step. As a client navigates the virtual world, the clinician monitors their anxiety levels and provides support and encouragement, all designed to help the client manage their anxiety and remain focused on the task at hand. Throughout the process, the virtual scenarios can be adapted and adjusted based on the client's progress, ensuring that the exposure remains challenging but manageable. Over time, as clients repeatedly face their fears in the virtual environment, they begin to experience a reduction in their anxiety levels and an increased sense of confidence and control. This process of becoming accustomed to the anxiety-provoking stimuli helps to weaken the association between the feared situation and the anxious response, ultimately empowering the client to face their fears with greater ease in real life. Virtual reality exposure therapy has been shown to be an effective treatment option for a variety of anxiety disorders, including phobias, social anxiety, panic disorder, and post-traumatic stress disorder. Research indicates that it can produce lasting improvements in anxiety symptoms, often with similar success rates to traditional exposure therapy methods.
For population use and its benefits, regarding cognitive, it can help with their attention, memory enhancement, and executive functioning. For psychosocial factors, it can help with stress reduction, social skills development, and self-confidence. And then regarding emotional regulation, it can help with coping skills, emotional awareness, and stress management. And then for our clinical application within mental health settings, VR is an emerging therapeutic technology that occupational therapists can use to promote occupational performance and mental health and engagement in their meaningful activities. It also provides immersive and interactive experiences that allow clients to practice skills in a safe, controlled, and motivating environment. And it can also be used to support their anxiety management, stress reduction, emotional regulation, mindfulness, and social skills development. It supports their occupational engagement by increasing their motivation, participation, and client-centered intervention. It can enhance cognitive skills through interactive activities and simulations, and it also promotes social participation.
When looking at assessment of client factors before using the VR, it's important that we look at safety and then the ability to engage effectively in the virtual environment, and then making sure we determine the client readiness and their goals so that the VR can even meet the standard or reach goals that they might want to meet. And then making sure we evaluate the baseline of the client, so looking at their cognitive, emotional, physical, even psychosocial factors that may influence the participation and treatment outcomes. For assessment of client factors when using the VR, cognition is a big thing. So looking at their attention, their memory, and problem solving, and executive functioning, making sure they can plan and understand what is happening appropriately within the VR environment and able to understand the instructions. Physical component is another thing. So assessing their vision, their hearing, their balance, and coordination. And for some individuals, they may get motion sickness from having the device on and then seeing what's around them. So making sure we ensure that safety and so they can have participation during the VR sessions. And then also emotional / psychosocial. Some clients may have anxiety, depression, different stress levels, and difficulty with emotional regulation or even motivation to do the VR game or whatever the case may be. So making sure we're looking at those coping skills because some of the VR experiences may either support symptom management or increase the stress for clients if it's not matched to their needs. And then lastly, you have occupational performance and participation. So making sure to identify those meaningful goals and meet the client where they are for a just right challenge and determine how the VR can support engagement in daily activities, social roles, or their overall mental well-being. For different VR interventions, we need to know that VR can provide realistic but it can be controlled experiences that allow the client to participate or to practice coping strategies, social interactions, and emotional regulations in a safe environment. For some VR interventions, we need to know that VR-based mindfulness interventions can be a factor that can improve anxiety, depression, while enhancing mindfulness and emotional regulation compared to just traditional mindfulness practices alone. And then some examples of VR intervention could be exposure therapy, so making sure the patient is gradually being exposed to anxiety-provoking situations, and then coping skills, applying these strategies to manage their stress or emotional challenges. And then lastly, you have cognitive training, so being interactive to improve that attention or memory, executive functioning, or problem solving, depending on the client and where they are.
Okay, next up are barriers and limitations to VR use in occupational therapy practice. So the first barrier is infrastructural constraints. The second one is insufficient professional training. The third one is limited access to appropriate technology resources. And the fourth one is high training and equipment costs. Some VR headsets can be over $1,000, making this very hard for clinicians to afford, or maybe small private practices. And then the VR impact on the OTPF domains. And then this one is occupations and client factors. So the OTPF domains are an essential area to address when working with virtual reality with clients. By doing so, it can help with better quality of life in individuals with mental health disorders. So for occupations, it can support increased independence and participation in ADLs, such as grooming, dressing, bathing, and feeding, IADLs, such as medication management, meal preparation, and home management, leisure activities, social participation, and play. For client factors, it supports the use of VR for impacting memory, attention, and problem-solving abilities in individuals with cognitive impairments. And then this can help simulate over to real-life situations, such as dealing with other people. And then evidence, VR-based interventions have demonstrated a promise in enhancing cognitive function and cognitive impairment, highlighting their potential as valuable tools in improving care for individuals with cognitive disorders. And then now we have performance skills and patterns. So for performance skills, the first one is motor skills. So VR activities can improve balance, coordination, postural control, and fine motor responses through interactive movement-based tasks. Process skills, clients can strengthen attention, sequencing, organization, problem-solving, and decision-making through structured VR environments and task simulations. And then finally, there's social interaction skills, and VR social scenarios allows clients to practice communication, turn-taking, eye contact, and appropriate social responses in a safe and controlled setting. And then finally, for performance patterns, the first one is habits. VR can support repetition of coping strategies, for example, mindfulness, breathing exercises, to help build healthy habits. And then for routines, structured VR sessions can help clients establish consistent self-regulation, relaxation, or skill-building routines. And then finally, for roles, VR can support role exploration and performance, such as student, worker, or community member roles through simulated environments.
This slide shows two VR programs we explored. The Job Simulator program builds executive function skills like problem solving, task initiation, and organization, while also requiring attention and bilateral coordination. While on the other hand, Fruit Ninja focuses more on motor planning and emotional regulation, using fast visual scanning and graded difficulty to improve attention and stress tolerance. We also looked at the Kayak VR and Wii games. The Kayak VR targeted bilateral coordination, postural control, and problem solving as users navigated obstacles and maintained trunk stability. The Wii games emphasized balance, motor planning, and attention while supporting leisure participation, social interaction, and frustration tolerance during challenges. Being able to explore these several different VR games firsthand helped us better understand their therapeutic values, and this also allowed us to experience the physical, cognitive, and emotional skills that each game can target in occupational therapy sessions. Across all programs, we considered the client's occupational profile, triggers, and the need to start with lower intensity simulations before grading up. We also looked at cognitive skills and severity of condition to ensure each activity was safe, appropriate, and meaningful. Our brochure highlights how virtual reality can support occupational therapy interventions in mental health by improving coping skills, relaxation, social participation, attention, and emotional regulation. It also demonstrates how VR addresses multiple OTPF domains, including occupations, client factors, and performance skills. Thank you for your time. We hope this presentation has shown the potential of virtual reality as an innovative and meaningful tool in occupational therapy.